Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Malata from Roots Community Health, reporting for the week of September 15th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. After an update on COVID and measles status, I'll talk about recent updates regarding flu, as well as some important responses to concerning federal actions related to health. First, starting off with an update on respiratory virus and measles status. And remember, this is taking a look at tests done in a clinical setting, so it will not include home tests for COVID, but it's still primarily rhinovirus enterovirus, so kind of the common cold in the gray line there, followed by SARS-CoV-2 in terms of the share of tests being done in clinical settings. And taking a look at wastewater, so concerningly, still kind of heading up here in almost all the regions. The Northeast and Teal might be leveling off, but we thought that about some of the other regions, and then they continue to go up. But the black line represents the national average, and that is currently in the level of high activity. And the highest is the South, followed by the West. And when we take a look at COVID epidemic trends, and remember, this is telling us about whether things seem to be going up, increasing, or declining, and it's based upon emergency department visits for COVID. And so this is our COVID epidemic trends. And we're still seeing that most of the West and South appears to be declining in terms of emergency department visits, and much of the North and Northeast is still looking like it is growing, likely growing in the lighter purple or growing in the darker purple. So we will see. Hopefully this means that many of the states in green have already reached their peak and are coming down, but we will just keep an eye on that. And taking a look at hospitalizations, those are still kind of heading in the upward direction there. Each state looks a lot different. Some of the states appear to have peaked and are coming down, while others are still heading up, and then others still are not reporting enough to give us an idea. So if you're interested in that, the link is in the post and you can check out what is going on in the different states. But on average, nationwide, still kind of heading in an upward direction there. But you can see that we're still not over where we were at our peak, our winter peak. And so we'll just have to see if this summer peak is higher than the winter. Last summer was particularly high, but hopefully this summer will be less so, but we will just have to wait and see. And in terms of deaths, we can see that the week ending September 6th, there were 185 COVID deaths. This is down from 246 deaths the week before. And this new surveillance page that has this information on it is no longer showing those shaded gray bars that we used to see for upcoming weeks and the preliminary estimates. And so we don't have those. So it's hard to tell whether this 185 is truly the direction things are going or not. So we will see what we see next week. But overall, that's better than it increasing. And the fact that we've been able to stay under 300 for many weeks now is certainly a positive thing, but something that we will continue to keep an eye on. Now, taking a look at measles, these numbers do unfortunately keep going up. So we are now at 1,454 measles cases in the United States. This is more than 5 times what we had in all of 2024. And we're still only just starting our 9th month here. And 86% of these are outbreak associated. 12% of these individuals were hospitalized for measles. So 1,454 cases for the year already represents the highest annual total since 1992, so 33 years ago. and is 5 times higher than the 285 cases reported in all of 2024. And CDC has already reported 37 different outbreaks so far in 2025 compared to 16 in all of 2024. And as a reminder, measles is more than just a rash and then you get over it. First off, it is highly contagious and can be especially devastating to babies, elders, those with compromised immune systems, and potentially anyone who gets it, actually. In fact, the 2 children who died this year from measles did not have any underlying conditions. So these were otherwise perfectly healthy children who were just not vaccinated. And in addition to being highly contagious, it can lead to respiratory failure, brain inflammation, and death. Also, it can wipe out prior immunity. So even those who seemingly recover fine may then have to contend with a number of illnesses that they had previously developed antibodies for. Like if they had had infections or vaccinations previously and had developed antibodies, those can actually be wiped out by measles infection. So this immune amnesia is a particularly sneaky and serious consequence of measles infection. And there's also a late complication of measles that is thought to be very rare, but with increasing cases, it's just something we are going to have to address and face. And this is a complication called SSPE, or subacute sclerosing panencephalitis. SSPE is especially feared. It's an especially feared complication that typically comes about years later, even up to 10 years after the initial infection. So the patient appears to have recovered, but then here comes this horrific condition, which is progressive, debilitating, and 100% fatal. So we've always said that SSPE is rare, about 1 in 10,000 people with measles. And especially since in the United States, we've had decades with sporadic cases, hundreds of cases. And so SSPE isn't something we've had to think a lot about in general. But something very important to note is that the risk of SSPE is thought to be much higher in those who had measles as an infant. So instead of 1 in 10,000, it's thought to be about 1 in 600. So this is something we must be thinking about if we're going to start letting measles run rampant through parts of this country, if we're going to get rid of vaccine requirements in schools, as we've seen already in at least one state that is trying to make the moves to do that. And many other states have made it quite easy to basically opt out of childhood vaccination, which is a lot like not having a requirement at all. And so far this year, we've had over 400 children under 5 with measles. So as those numbers continue to climb, we might expect that we will see this terrible complication more in the future. Just last week, LA County issued a press release announcing the recent death of a school-aged child from SSPE. So this child was originally infected as an infant before they were able to get vaccinated. So remember that first dose is typically given between 12 and 15 months of age. And this child got measles when they were too young for the vaccine. They were thought to have recovered fully from their measles, but sadly, this child developed SSPE, and this is a progressive brain disorder where the patient just progressively loses all neurologic function and then dies. And this progressive loss of function occurs generally over a period of 1 to 3 years. So this is absolutely agonizing. There's no effective treatment. There's no cure. And this is just one of the things that we are setting ourselves up to see in the future if things keep going the way they are going, with vaccination rates dropping across much of the country. Muntu Davis, the public health officer in LA County, who actually Dr. Davis used to be here in Alameda County, he was quoted as saying that this case is a painful reminder of how dangerous measles can be, especially for our most vulnerable community members. He went on to say, infants too young to be vaccinated rely on all of us to help protect them through community immunity. Vaccination is not just about protecting yourself. It's about protecting your family, your neighbors, and especially children who are too young to be vaccinated. So important words and really a reminder of how vaccination is more than just an individual choice. It is one that is going to potentially affect those around you. And now I want to take a moment to talk about flu because we're getting ready to be heading into flu season pretty soon. There was also a recent morbidity and mortality weekly report put out by the CDC a couple of weeks ago that goes over prevention and control of seasonal influenza with vaccines. And this includes the recommendations of the Advisory Committee on Immunization Practices, and the report reflects the discussions that committee had back in April and in June. Luckily, the bottom line is they did not change much, which is a good thing, particularly with all that has been going on to undermine access to and confidence in vaccines. But essentially, they continue to recommend an annual flu vaccine for everyone 6 months and up. The FDA has also made its recommendations about the composition of the 25-26 flu vaccine, which is updated compared to last year. Most of this here regarding the flu vaccine is unchanged, except for number 4, which I will talk through in a minute. But flu vaccine is still recommended for everyone 6 months and up. The ideal timing is still at the onset of flu season, so September, October. Most places should have received their doses by now. And the main caveat to this timeline is that people who are in their 3rd trimester of pregnancy in July or August should get the flu vaccine, even though it's considered early or prior to flu season, because we know that this reduces the risk for those infants while they are too young to be vaccinated. So we've passed that time period for this year already, but I wanted to mention it because, again, when babies are too young to be vaccinated, then we need to step up to protect them either through maternal vaccination and also through others around them being vaccinated. And of course, babies can be vaccinated when they are 6 months old, but that vulnerable period of 0 to 6 months is where that passive immunity or the immunity through maternal vaccination would protect them. Now, before I talk about some of the new developments with flu vaccine, I wanted to remind us of last year's flu season. The 2024-2025 flu season was classified as high severity across all age groups. Sadly, there were a total of 279 pediatric deaths from influenza for this season, and approximately 90% of those were unvaccinated children. Many of them did not have underlying medical conditions. So the only thing was that they were not vaccinated. This represents the highest disease burden that we have had from flu in over a decade. So the good news is that this year there are some new options for flu vaccination. The first one is a flu vaccine called Flublok that contains no eggs and was recently approved by the FDA for individuals 9 years and up. It was previously approved for 18 and up. So this is good news for folks with egg allergy. And not only that, but with all the challenges that we've been having with H5N1 impacting our poultry and our egg supply, having a flu vaccine that does not rely on eggs is good for our supply chain, and it is good for our pandemic preparedness. The other new development I wanted to share is that FluMist, which is the nasal spray flu vaccine, is now approved for home use. Now, remember, FluMist is what we call a live attenuated vaccine, and that means that it has weakened influenza virus, and it is delivered through a spray into the nose. So this is obviously good for people with needle phobias or challenges coming into a medical facility, and it is now approved for use at home by the patient or their caregiver. Of course, with any convenience like this, there are also challenges that we should note. So first of all, it should be said that not everyone can get a live weekend vaccination. So this is only recommended for people aged 2 to 49. So the younger age groups and the older age groups are not eligible. Also, this is not for pregnant people. It is not for people with immunocompromising conditions like HIV or cancer. But for many people, this may be a good option. Now, something to note is that patients will need to understand the storage requirements and the handling requirements and know how to properly administer the vaccine. Normally, when we give vaccines, we monitor folks for a while to make sure that they don't have any adverse reactions, like for 15 minutes or so. So ideally, with home administration, the patient or caregiver would be prepared for this. The most common immediate reaction we worry about is a severe allergic reaction, or otherwise known as anaphylaxis. So having an EpiPen handy, being able to quickly get medical attention would be critical in the rare instance that this would happen. But overall, this really is going to expand access for folks, and so it is a good development. Now I wanted to add on to what we've been calling a states watch, where we lift up some of the things that states are doing to mitigate the harm being caused by federal actions that are gutting our health agencies and undermining their credibility. So last week I mentioned that California, Oregon, Washington, and Hawaii had formed the West Coast Health Alliance. A similar alliance seems to be forming in the Northeast. New York, Massachusetts, and New Mexico have also each created their own state-level policies to preserve vaccine access. Maryland lawmakers signed a measure that locks in the state child immunization schedule, and this was kind of in a move to prevent future changes at the federal level from affecting state requirements. And recently, health officials in 3 more states, Illinois, Arizona, and Virginia, took steps to ensure access to updated COVID-19 vaccines as well. So in many cases, these states' governors have stepped up. They've issued executive orders that have given direction to their health departments and to the pharmacy boards to allow pharmacists and providers to act in accordance with the science. I also wanted to highlight another potential bright spot, this one coming out of California. And this is an effort to restore funding for scientific research through a bond measure that could go to the voters in 2026. So this bill is called SB 607, California Science and Health Research Bond Act. So this is a very large proposed plan with a price tag of $23 billion. Still has a lot of hurdles to get through, so it remains to be seen how far it will go, but still encouraging to see that we are not just lying down in the face of all of these very serious cuts to scientific research. And lastly, I wanted to mention another response to the concerning actions of the United States federal government, but this one is coming not from our states, but from the World Health Organization. This statement from Dr. Tedros, the Director General of the World Health Organization, talks about how the CDC has been a center of excellence for quite a long time that other countries have emulated. He talks about his own professional journey and how the US CDC has inspired many across the globe to establish their own CDCs. And he ends by saying that the US CDC, while of course not perfect, has been invaluable and must be protected. So it's good to see that the world is taking notice, also encouraging to see our states stepping up. And I think this is a cause for some hope during what can otherwise feel like pretty bleak times as it relates to healthcare leadership. It's good to know that even in the face of significant challenges, there is a commitment to public health at the state and local level and across the globe that will all be critical as we navigate these times. And in the meantime, we just continue doing what we know we need to do to keep ourselves and our loved ones and our community safe. And let's remember to do what we can to avoid infection and reinfection. If you don't feel well, take a test to rule out COVID and get timely treatment if you're someone who should be treated. And let's remember, if you don't have a primary care provider, please get one, know how to reach them before you need them. Make sure that they are using practices that are based in science and in evidence, including recommendations around vaccinations and screenings for your age and situation. And if you don't feel well, please rest and recover, and also isolate from others so that you don't spread around what you have. Otherwise, get some regular physical activity, get some fresh air. It is warm out there, at least here in the Bay Area. Make sure you stay well hydrated. Also, eat a balanced diet. Avoid those simple sugars and processed foods and artificial ingredients. Limit your alcohol consumption. Quit smoking. Any amount of smoking is harmful to your health. And and manage those stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.